Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome back to this episode of Let's Clear the Air, all things allergy, asthma, and immunology. I have the great pleasure of being back with Dr. Phil Jones.
Marcella, thank you for letting me come back again. Not to sound shocked or surprised.
Oh, no. We love you, and we were excited to have you back, or to be back with you, rather. So I'm going to just jump right into it. We are talking about stinging insects, which I guess 'tis the season for stinging insects.
Absolutely.
We have had some queries about it lately, and so we thought we'd go to the expert to get some input. So, Dr. Phil, it is late summer, and my thinking was that, well, surely these guys are slowing down, but we were just talking, and you were saying, no, actually, they get kind of more spry right now.
They definitely get a little more aggressive. Okay, so I always tell patients in the spring, if you're bee venom allergic, you want somebody to come in and keep an eye on your eaves and your, an exterminator to, make sure a non-allergic patient to take care of those things. But in the spring, you get close to the nest and they won't bother you too much. But in the fall, they get more protective and they're more aggressive. Kind of as the colony life cycle ends, they rev up their aggressiveness, I would say. And so there's not really a bee season, but every year, late August, September, October, I will have a surge in referrals for bee venom reactions.
Wow. Okay. Yeah, that's surprising. I was not aware because I guess I just assumed that spring is when they're going to be most active looking for food or pollen, those type things. So that's interesting. They're coming to their last days and they're desperate.
They're happy in the spring. They're doing their thing. They don't care about you. But as the colony grows and they're ending the cycle, they get aggressive.
Okay. Well, let's talk about what kind of stinging insects there are out there.
Yeah. So part of that depends on your geographic location. But here in East Tennessee, we have bees. So we typically think of honeybees and bumblebees. We have yellow jackets, we have white-faced hornets, yellow-faced hornets, and yellow jackets. And of those, the yellow jackets seem to be the real bad guys, okay? So I'll see, hundreds of yellow jacket reactions to every one honeybee reaction.
Are they just more prominent? Are there more of them out there, or are they more
I think
aggressive?
We're most likely to cross paths with them. They love to build in shrubbery around the house. They love to build in the ground, and you mow or bush hog, and they come up out to protect the nest. And in the fall, late summer, fall, I always think of children, and they're outside, and they're at school, and the teacher takes them out at lunch, and they've got peanut butter and jelly on their hands, and the yellow jackets like to eat that too. And so they're landing on hands and things, and so they're very prone to sting us.
Wow. And so those are also the type of insects that are around like garbage waste bins outside of...
Yes. They don't, you were talking about flowers and stuff. They like this stuff we eat too. I mean, if you sit outside and eat a watermelon, they want some of it. If you're eating peanut butter and jelly sandwiches, they want some of it.
Wow.
And I always tell my patients, if it lands on you and you can somehow manage to stay calm, he won't sting you just to sting you. But if you're swat him, or if he's between your fingers and you twitch and he feels that pressure, he'll sting you very quickly. Okay. And some of them can sting you once, like a honeybee, and some of them, like yellow jackets, can sting you multiple times.
Yeah. Now, are the yellow jackets, are they, I cannot remember, are they truly yellow or are they more black? Because I was just walking around the neighborhood the other day and saw a bunch of black-looking hornet things all on the ground, like flying just above the ground.
That's one of the problems with bees. Every community has a little bit different name for this bee and that bee and those kind of things. But technically, yellow jackets are yellow and black.
Okay.
And they're a small to mid-sized bee. You wouldn't look at it and say, wow, that's a big bee. Like a hornet. That can be a much bigger bee.
So we talk about avoidance. That's always best, as you just said. Keep your areas around your house clean. I know they nest in trees as well, some of them.
Yes, yes. So, yeah, avoidance is the goal, but I always tell patients you didn't get stung because you knew where the bee was, right?
True.
You got stung because you didn't know where the bee was. So,
Right.
so avoidance clearly is important. I mean, if you're honeybee allergic, don't walk around in the yard barefoot. If you're yellow jacket and hornet allergic, it's best not to be eating and drinking outdoors because they share that with us. People drink sugar drinks, sodas, and those kind of things, or tea, and they like to get in that too. And so you go to drink that drink, and there's the the hornet or yellow jacket in the can.
Ooh.
I saw a patient one time, Marcella, that he was drinking his tea on his back porch, his sweet tea. He left it, went inside, even went to bed, woke up the next morning, came outside, and he saw his sweet tea sitting there, and he thought, well, I'll just have another sip of that. And he got stung in his mouth and actually swallowed the bee. So you just have to be very careful, okay?
Oh, my goodness.
So no barefoot. Eating and drinking outdoors if you're bee allergic is a risky thing. And but again, we do see a lot of bee venom allergies, and a lot of people don't know what kind of reactions you can have to bees, how severe they can be. And unfortunately, medical care, healthcare providers don't know all the nuances of what are the treatment options for a bee allergic patient. Okay.
Well, now let's talk about, once you've been stung, depending on the type of insect it is that has stung you, that's kind of what your next steps are, whether or not they've left its stinger or if it's one that can sting multiple times. Is
Right.
it typically the honeybee and the bees rather that sting just once and leave their
Honeybee
stinger?
tends to sting once, and they usually, not always, but leave a stinger behind with a venom sac, and that's kind of like a clue as to which bee that was. But honeybee's really easy to figure out. Where were you? Well, I was out in the yard. Were you barefoot? Oh, yeah, I was barefoot. And where did it sting you? On the bottom of my foot. That's the typical honeybee story. Now, you can get into their nest accidentally and those kind of things, but they're just not as common as they were. We don't see the getting into the nest like we used to. Where they got stung is very useful. If I got stung on my upper body and it came from above, I think wasp, yellow jacket, hornet. But remember, yellow jacket and hornets kind of can get into the ground too, so that's not always a perfect clue. How many times you got stung is important. I also like to ask questions, well, what happened and how soon after you got stung did you start having symptoms?
So look for the stinging site, or maybe more than one. If you see a stinger left, just gently brush it off. Correct? Don't try and
Don't grab it with your fingers and squeeze because that's more venom, right?
Right.
And so it is nice to just gently remove that stinger and the associated venom sac with that as gently as possible. And yes, gently wiping it, or even small tweezers where you can grab as close as you can to the stinger's tip and pull out works best.
And what is the difference between a normal reaction someone might have versus an allergic reaction?
Yeah, that's a great question. So all of us, it's going to hurt when we get stung, okay? And so that's not unexpected. And so I always tell patients, if I get stung on my finger, I expect my finger to swell, okay? So that's a local reaction. We can manage that with elevation, a cold compress, ibuprofen if it hurts, those kind of things. But that's not an allergic reaction. If I get stung on my finger and my whole arm swells, boy, it's scary to look at. It's a large local reaction, but not an allergic reaction. And so those, and I get those referrals frequently. My hand swells when I get stung, or my whole arm swells, and so that's not terribly unexpected. Patients with large local reactions, meaning the whole limb swells, my whole leg or my whole arm, have the tiniest increased risk of a systemic reaction down the road.
Okay.
But in general, recommendations are it is so low, we don't do bee venom allergy testing or a thing called bee venom desensitization, okay? But tell those same patients, if I get stung on my finger and it swells a little bit, but I break out in hives, that is more of a systemic reaction. But that patient also is at very, very low risk of a more severe systemic reaction down the road, okay? So we don't, in the old days, when I first started doing this, we won't say how long ago, when I first started doing this, we would allergy test those patients, and some of those would go on allergy shots for bees. But more recent data says the patients with hives, and that's the only manifestation of the reaction, are very low risk. And there's so many nuances in venom and decision making on who needs treatment, who doesn't, that would take much more time than we have.
And if they have hives, then something like an antihistamine would be fine
great.
to take.
Absolutely. If they get stung on their finger and they have lightheaded, dizziness, confusion, that means their blood pressure's dropping. And in some patients, that's all that happens. They don't have any other symptom. Their blood pressure bottoms out. And that's a unique group of bee venom patients that tend to have an underlying mast cell disorder. They're usually men. It's hypotension, loss of consciousness. And they're a particularly high-risk group of patients. And then there are patients in between the hive patient and that cardiac, the blood pressure bottoming out, that are prone to have lip swelling, tongue swelling, throat swelling, chest tightness, wheezing, and shortness of breath. So that's kind of one of the first things we look at in a bee patient. Are you low risk or are you at moderate to high risk? All right. We're more conservative with low risk patients. Of course, we're going to be much more aggressive in our treatment planning with moderate to high risk patients.
And so do you put both the moderate and the high risk then on treatment plan?
Yeah, so patients are always like, well, I'll avoid it. And we've already talked about the challenges of that. And I'll carry an EpiPen. But patients don't realize how quick bee reactions can occur. So they'll be out on the tractor, way out in the field, and the EpiPen's in the house. So we always have to stress, if you're outdoors, if you're in a location where you can be stung, you need to have that EpiPen with you, okay? So avoidance, EpiPen, and then there's a thing called bee venom desensitization. And it is a wonderful tool that really should be taught more to interns, residents, any healthcare provider, okay? So if I've had an anaphylactic reaction, Marcella, to a bee, my risk each time I get stung is about 70% that I'll have another anaphylactic reaction. Those are horrible odds. 7 out of 10 stings, I'm going to have anaphylaxis. You'd certainly want a better plan than just avoidance and carrying an EpiPen. And those patients, their quality of life is horrible. Every time they see a bee, they panic. They don't do things. I don't want to go outside. I might get stung. Let's go hike. Let's do this, that. They avoid those type things. So bee venom desensitization is a process where we just gradually expose your immune system to gradually increasing doses of venom over a period of time. And that takes that risk from 70% chance of anaphylaxis on resting to less than 5%. And if it does react, it tends to be limited to the skin. I mean, I don't call that a cure, but boy, in my world, that's about as close as you can get.
That's improving your odds by a big
improves your
percentage.
odds, your quality of life.
Yeah.
I mean, all kinds of things. And every patient I meet and talk to them about this, there's like, because many of them I've met have had anaphylaxis for the last 30 years when they've gotten, and they're like, no one's ever told me about this. So it's just, I wish we could get that. Well, that's what we're doing today, isn't it? We're getting that message out that bee venom patients can have a good quality of life and do outdoor things that they like to do.
And to be clear, it's not just bees. It's also the hornets. I mean, this venom immunotherapy is for all stinging insects.
Yes, and we didn't get into fire ants, but yes, there's even fire ant anaphylaxis, and they're moving our way. Hopefully they won't make it.
No, thanks.
No, hopefully they won't, but I suspect we'll see those. But we do have a few patients who spend time in Tennessee and southern states and have fire ant anaphylaxis, but same philosophy, avoidance, EpiPen, fire ant desensitization.
Okay, good. Yeah, I have a very good friend of mine. You just said it. She was scared to go out in the summertime or even late fall, early fall rather, and because of a an allergy to stinging insects, and she saw one of our providers as well and got on venom therapy and has made a big difference.
Absolutely. Good for her. Glad she did.
Yeah.
One other thing, Marcel, is we don't want to make bees the bad guys, right? They do good things, okay? And they don't sting us just out of meanness and this kind of stuff. So we need them. They do very important things agriculturally and different things. But yes, for a few of us, they cause bad problems.
Yeah. Let's talk about real quickly 2 questionable issues. You've got some people, since we're talking about bees anyway, you've got honey and the use of it for, just real quickly, on allergies. Who knows if there's something out there that it might help venom as well or stings, but that's not true, correct?
Yeah, correct. So we have a lot of patients, they'll come to me and they say, boy, I use local honey. And with a philosophy there that if they're pollen sensitive, there's enough pollen in it to take away their pollen allergy, or there's enough venom in it. And in either case, I always tell my patients, it won't hurt you, but it's not going to help you either, okay? So there are certainly better therapies than local honey.
Right. And the second one that I've heard, is it true that if you've had a reaction to a stinging insect, that next reaction will be greater? I mean, you did say something about there's this certain percentage, but it's not necessarily true that if you've had a anaphylactic reaction or some type of severe reaction once, the next time will be worse, or is it just
so, Marcel,
depends?
The answer to that question depends on where you practice in the scope of healthcare, okay? And so ER doctors will always tell patients, next time will be worse. But you're right. The data is reactions, whether we're talking about food allergies or bee reactions, are highly variable from one to another, and it can depend on the amount of venom, the time of year. There's just so many nuances that go into that. But I always make clear to my patients, yeah, you've had a bad reaction, but it doesn't necessarily mean it's going to be worse. Okay?
Right.
Yeah.
And at least, like we were saying earlier, limit your chances at having a reaction and get on immunotherapy, or and make sure to have your EpiPen.
Yes.
Now, just because I'm allergic to, let's say, honeybees, am I going to be allergic to yellow jackets?
Yeah, so it's interesting with bees. There is some cross-reactivity in bee venoms, and historically it was a little bit difficult when we tested patients, because we usually will test. If you came in allergic to honeybee, I'm going to test you to honeybee and wasp in these, because we don't know, okay? But there's some cross-reactivity, and then the question was always, well, am I truly honeybee and vespid allergic, or is it just cross-reactivity? But now we have component testing, a way to break down those venoms, and we can determine through at a molecular level, that's just cross-reactivity, or no, they're truly allergic to those 2 separate families. So in the big scheme of things, it just means fine-tuning your immunotherapy to your specific trigger, which means less shots, less involvement, less cost for that matter.
Well, and we are very good at doing that here, getting in there and fine-tuning, finding out what you're allergic to and making sure you're getting the appropriate immunotherapy.
I think so,
Yeah.
yes.
We might be a little biased, but we do have patients agree with us.
Yes.
So. All right, well, Dr. Jones, I appreciate it. I won't take up any more of your time, but we are so glad that we got to have you this perfect time of year, since it is going into late summer, early fall, and those insects are going to get a little crazy out there. We're going to get everybody as prepared as we can.
Absolutely. Thank you, Marcella. I'm looking forward to another one.
All right, we will speak with you soon. And that's it for Let's Clear the Air.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.